Hey guys, Dr. Greg with Movement Driven Performance Physiotherapy. Today we're going to talk about some bridge progressions. So this is the super kind of beginner level bridge progressions. This is for the patients with low back pain, hip pain, or maybe just a little more out of shape and you need to start somewhere to kind of fire those glutes. Okay, so this is another one of those kind of core foundational movement patterns, especially for my youth athletes. If you can't properly engage your core and your glutes during this movement, then you can't expect it to go do it when you're lifting heavy in the squat rack or you're on the field doing more rigorous movement. So if your glutes aren't firing here and you can't get them to fire in isolation, then you can't expect them to be there for those bigger movement patterns. And what happens is if the glutes aren't there, the low back, the hip joint, other muscles start to compensate, and then things just start to break down over time. So we're trying to kind of get those glutes to fire a little bit more automatically, have your brain and those glutes to be on a better communication level, so that you can volitionally fire them when you need to, okay? So with the bridge, super simple, but pay attention to the specifics, right? So this is the bridge position, okay? Knees are bent, feet are about shoulder width apart for the basic bridge. And I'm going to kind of start with a little bit of a posterior pelvic tilt, nothing major, but I'm just kind of tucking my belt buckle towards my sternum, belly's tight, and I start to engage the glutes as I go up, okay? So at the top, belly's still tight, I'm squeezing my butt cheeks together. That's key, okay? Don't let the low back do all the work. You're using low back muscles, you're using glute muscles, you're using hamstring muscles, but you gotta make it a primary glute exercise. So I'm squeezing and I'm tilting, and I'm not going all the way up and arching my back, because now it's all back. Now I'm just straining my back. That doesn't feel good, okay? So a little bit of a tuck. I'm going up. I'm squeezing the glutes. Maybe I hold for 1 second, and then I control back down. Okay? And then we can progress that, all right? So my progressions of that, usually I go to cross knee, okay? So when the regular bridge is too easy, you want to start to isolate unilaterally, and just one glute at a time, especially if you're one that's a little bit weaker. We're gonna go cross bridge first, same movement, I'm tucking, and then I'm squeezing that right butt cheek at the top. You'll get a little bit of a stretch in the left hip. Make sure that pelvis doesn't rotate, it stays perpendicular to the floor, or excuse me, parallel to the floor. I'm squeezing, glute, turn it on, come back down. All right, then we're gonna progress that to a single leg bridge. So now I can put my legs straight out. My knees are even, okay? Same concept. I'm squeezing, now I'm doing the left one. So I'm rotating up, I'm squeezing, I'm keeping that pelvis, I'm not letting it rotate, and I'm keeping my knees even. I don't want that leg way up here. Keep the knees even, and go up and down. Good. All right, so add those into your program, progress as needed, and then when those are easy, then let's start to load it with some weight. Put a barbell on there, put your back up against it, on top of a chair, on top of the bench at the gym. We'll have more videos later on kind of talking about more progressions and how to really start to strengthen those glutes. Thanks guys.